introduction on our work on environmental health and toxics and some of the key issues that we want you to learn about to really lay a foundation on these issues so that you have the background information that you need. And again, as Mara said, everything will be recorded. And so we will be able to go back to these and look at these as time goes on, especially in this new time period where we may have a few things be delayed that we thought would happen more quickly. You may want to come back to these slides as a reminder. So our learning objectives today are to focus on 3 routes of human exposure to toxic chemicals in our home and environment, and then be able to list 3 health problems linked to exposure to toxic chemicals in products, our homes, and the environment. The outline of what we're going to cover is talking about why we have a toxic problem with chemicals in the environment and in our homes, various routes of exposure, diving into talking about certain types of vulnerable populations, other considerations you need to think of in terms of toxics and human health, some information on body burden or pollution actually found in people, a helpful acronym here that you may or may not have already come up with CHOPS, and then some discussion of why we're so toxic and what we can do, and a focus on what the Ecology Center has been doing, and to give you a little bit of information about what you all will be working on, those of you who are working on toxics projects for your practicum period. So one of the things that we want to focus on is that many different everyday items contain toxic chemicals linked to adverse health effects. And throughout the course of the fellowship program, you'll learn why certain chemicals have impacts on learning and developmental disabilities, increased rates of infertility and difficulty conceiving, thyroid and other hormone disruption, and even certain types of cancer. So the environmental contaminants that we come into contact really come from many different places, as the photo here shows. From the consumer products that we may have every day, like the baby in the picture there, from our drinking water, from the things in our homes, from cleaning products, from our food, and even from our personal care products. We'll go into detail on some of these other things. So there are several main routes of exposure that most people have to toxic chemicals. That may be through inhalation. So you might think of breathing in contaminated air, either from cleaning products, or perhaps you live in an area where you're next to a polluting facility and you might have inhalation there. Ingestion, I mean, I think this is one of the ones that's more obvious for folks. If you're eating or drinking, or even if you have hand-to-mouth behavior like many children, young children and toddlers do, you're going to have ingestion of toxic chemicals. Skin absorption is another one that I think is often overlooked. And what's important here is when you think about things like personal care products that may have chemicals in them, so your lotions and your makeup and things like that, we're learning more and more about how the body can actually absorb through our largest organ, the skin, many of these different chemicals. What's not pictured here, and I think is particularly helpful for health professionals, is to actually think of exposure that might come intravenously. We will have some information later in the program and when we have our facilities visit and hear from experts working in healthcare on how you can be exposed to certain chemicals like hormone disrupting phthalates through IV bags and things along those lines. So while that's not a common exposure for everyone on a day-to-day basis, it is important, particularly for many of you who do work in a clinical setting, to think about what might happen in terms of intravenous exposure. So there's a number of things that it's really important for us to consider when we're thinking about toxic chemicals in the environment and how they might impact ourselves individually or the communities that we work in or we serve. So the first picture here of the man here in the fish, it shows bioaccumulation of the chemical mercury. And what this shows is that, the higher you are up on the food chain, the more a particular chemical is going to build up in your body if it has particularly bioaccumulative properties. So mercury is a good example here. Mercury is really common in the environment. In Michigan, it's found in almost, I believe, almost every body of our inland lakes and rivers, largely because of coal-fired power plants and historical and ongoing contamination there. But sometimes other mercury contamination can come from other sources. Mercury is not the only bioaccumulative chemical, it's just the one here. Unfortunately, if we were to think about this, the top of the food chain actually is the breastfeeding child. So we think it's particularly important, since breast milk is the best and safest and most nutritious, and has very many other health benefits for children, that we need to protect our food system starting at the bottom, making sure that we're protecting everyone at the top, particularly infants and breastfeeding children who are going to be taking in even more of those toxics. So we want to continue to encourage folks there. I'm going to touch on timing a little bit here and then move more into it in the next slide. But the timing of exposure can be particularly important. We know, for example, with a chemical like bisphenol A, which folks may remember, people moving out of BPA in baby bottles, and now in a lot of canned food, they're moving away from that, unfortunately, sometimes to sister chemicals like PFAS. However, the timing of exposures to that chemical in rat models, for example, can show detrimental exposures relating to breast health in animal models, in animal experiments, even at a particular day in utero exposure. So our timing can be that sensitive, or then we can think about larger scale timing and how children are particularly vulnerable due to very healthy natural behaviors like hand to mouth behaviors as toddlers and babies explore their world, or things along those lines. So I'm going to dive more into timing in a moment, so keep that in mind. The other thing, moving across the slide here to synergy, that I want to make sure we talk about is that, many times we are not exposed to just one thing at a time. We may have exposures to toxic chemicals and be living in a really stressful environment, perhaps with other things that create stress, like poverty or malnutrition or things like that. So to use an example of lead poisoning, when you have a child who's exposed to lead in a home and they also are malnourished, they're more likely to hold on to lead in their bones if they don't have the proper nutrients in their diet to give them a little bit more resilience, so that they're not holding on to the lead in this example. So stress is also really important. Again, if you think about hormone disrupting chemicals like bisphenol A or BPA, you can have detrimental impacts when you have high levels of cortisone in your body because of stress, and you have that chemical exposure at the same time. So that's an important consideration there. So this is why you may hear when you talk to lawmakers, oh, well, I played with mercury, for example, in my hand when I was a child. Not having them think, well, there's many different things that are complicated there, or I lived in a home that probably had lead paint, and I'm fine. First of all, we can't really know whether or not the person who is in a home that had lead paint in it is actually fine if they didn't lose IQ points, which we can talk about a little bit later. The other thing we don't know is, what are all the other synergistic effects? What are the other things that were happening in that child's life, in that person's life when they were a child? Did they have really great nutrition, and so they were fine? Was everything as best as it could be in those sorts of things? Did they have a happy childhood? There was not a lot of economic stress or things like that. There weren't any other chemical exposures from a manufacturing plant belching out chemicals next to them. So it's important for us to think about that. I'm going to hit low doses here last, but individual susceptibility. Not everyone, because of both the social and economic side of things and because of just our own unique biology, is going to be as susceptible to impacts from a disease as you all know. We can see this even with the COVID virus, or the COVID-19 disease right now. Some folks have more, or either less likely to have negative health impacts than others because they don't have other pre-existing conditions, for example. because of their age, because of their general health, whatever those different individual susceptibility things are, that's important for us to consider. The same goes for toxic chemicals. So you all know this. This is pretty common for many different things. If you're thinking about toxic chemicals, you would be thinking about other impacts in health from other confounding factors outside. So the thing that I want to cover with low doses is that we've learned a lot over the last couple of decades. I think the next slide is about endocrine disruptors. And we used to think that the dose makes the poison with toxic chemicals, that, in that dose response curve that you see there at the top of the slide, the more exposure you're going to have to something that's harmful, the more problematic it's going to be. But low exposures would be fine. We used to even say dilution is the solution to pollution. Unfortunately, that is definitely not the case with certain types of chemicals. What you'll see in the bottom are what's called non-monotonic curves. And this is particularly important to hormone disrupting chemicals like phthalates or bisphenol A, bisphenol S, and other, or even certain types of flame retardants, where you might have an exposure that works on a really low level and can have a biological impact, just like hormones do in our bodies. So there's a couple of different examples there where you may have sort of the worst impacts, the highest responses at the middle, or you have higher or more significant responses in the second image there for very low exposures or very high exposures, and not as much happening in the middle, and so on and so forth. So those are some examples there to think about the very low levels in which hormones work in our bodies, and the very different impacts that we might see from hormone disrupting chemicals that mimic hormones in some ways and may have a different effect than we might see with something like mercury, where you're going to have that higher dose response, for example. So I mentioned timing, and one of the things that is important to think about timing of exposure is to really think about the most vulnerable populations that we have, particularly those first two spots there relevant to timing: children, babies, and the developing fetus, and then pregnant people, I should say. Before a baby is born, there are critical developmental things happening in all of their organs and tissues, as all of you know, including their rapidly growing brain, reproductive and endocrine systems, and all basically all of their systems. What the fetus is exposed to early can cause birth defects or actually alter their health later in life. Also leading to other adverse outcomes like preterm delivery, things along those lines. So using CDC data, the University of California at San Francisco study found that over 99% of 250 pregnant women they studied were found to carry multiple toxic chemicals in their bodies that could be passed on to the fetus, including pesticides, phenols, flame retardants, endocrine disrupting phthalates, more legacy contaminants like PCBs. The potential effects of fetal exposure to these compounds are really great. So phthalates, for example, are anti-androgenic. These are chemicals that are found in many different consumer products. They're found in many things. They're used to soften vinyl, plastic. We call them the everywhere chemical. They're actually quite common in contaminating our food system, particularly in higher fatty foods. So again, back to the exposure side of things and the problems. So these can interfere with male genital development, for example, in the fetus. Female exposure to bisphenol A or BPA has been linked to worse behavioral and emotional control later in life. Flame retardants, which we'll talk about a little bit later, have been linked to low birth weight babies and neurotoxicity. Fetal exposure to pesticides and insecticides can lead to miscarriage and preterm birth defects and impaired cognitive development. Unfortunately, we used to think a long time ago that the placenta would protect the fetus from environmental contaminants, and that's just not true. The fetal brain, in particular, is very vulnerable because it lacks a blood-brain barrier, as you all know, to provide protection, and also lacks detoxification capabilities. Excuse me. So that's just the fetus. I want to be mindful of time, so I will move a little bit more quickly through children and babies and toddlers. Um, Children are also highly vulnerable to environmental toxicants. Like the fetus, they're growing rapidly and developing rapidly. Not everything is developed yet. And they also consume more air, water, and food than we do as adults. They receive, as a result, a disproportionately large dose of environmental toxicants. For example, babies and toddlers are living closer to the floor than we are as adults and are likely to have exposure to contaminants in the dust. We may think of lead paint, for example, is a very common one, but there are other airborne toxicants like flame retardants that come out of our furniture or electronics that can then expose children. Or things like volatile organic compounds that accumulate at ground level, like or airborne toxics like radon, mercury, and other vapors. Kids, very naturally, particularly young children and toddlers, explore the world by putting everything into their mouth. This is a way that they figure things out, and that is a generally healthy behavior unless what they're putting in their mouth happens to be toxic or contaminated with something that may be toxic. So if we think back to that picture of a little girl and we think of those ingestion exposures, that's particular interest there. Um, there are particular developmental windows that may have more of an impact than at certain other ones. We mentioned this before when we were talking about that. Just because a particular system may be rapidly developing at one time of life than the other, the timing of exposure can be really problematic at one point. The same thing that happens with babies and children could be said with pregnant people. They're going to, as we said in the fetal example, the placenta doesn't actually provide protection. A lot of different chemicals unfortunately, are transferred from mother to child in utero. The next one that I want to talk about is workers. We'll dig a little bit deeper into this later in the analysis, but workers in different occupations have been found to have higher levels of certain types of toxicants. So we're going to look at some occupational exposures in a bit. Finally, the last one that I want to mention with particularly vulnerable populations are those folks who live in hotspot communities. These are communities that, again, may face a disproportionate burden from polluting industries. Catherine, who's going to speak later about food systems, knows this work very well. She's worked with a lot of environmental justice issues in the city of Detroit, working with communities that are facing pollution from different industries, from higher levels of air pollution and water pollution, and so on and so forth. So that's important to think about in terms of the vulnerable populations as well. Often these communities also have other socioeconomic stressors, such as poverty, racism, and a lack of access to healthy food. These factors can all be combined with higher burdens of pollution to make people living in toxic hotspots more vulnerable to environmental diseases than those folks who are living elsewhere. So biomonitoring, or body burden testing, has found many toxic chemicals in all kinds of different people. Pregnant women found in breast milk, for example, different chemicals, umbilical cord blood, in newborn infants, in health professionals, which we'll talk about a little bit more when we talk about occupational exposure, in children's and adults. You can see in the image here, that's a list of just a few chemicals. Obviously, in the state of Michigan, we have quite a few people who are concerned now about PFAS, or polyfluoroalkyl substances, that are contaminating the drinking water of about just shy of 2 million people in the state of Michigan, and also have been found in some testing for impacted communities to have very high levels in people's bodies. So I want to move into where exposures might occur for folks, and go through some examples here with you and a helpful memory aid that you can use to think about the various domains in which toxic exposures happen. So that's CHOPS, or community, home and hobbies, occupation and or school, personal choices, and socioeconomic factors. So if we start with community, some of these are things that we've talked about before. So where you live and what you are co-located next to has an important impact on exposure. So you can see some examples here of a child playing next to a polluting industry, landfills, agricultural production and pesticide sprays, increased traffic. So you might have many different contaminants coming there from out of the tailpipes of the different cars there, or even public parks that may be sprayed with pesticides or something like that. So even a green space can have, unfortunately, if not done properly, can have environmental exposures for people in communities. Moving through, if we go to home and hobbies, you can see this, an example of the home here. I'm just going to touch on a few pieces here where you might actually find different toxic chemicals in the home environment. So I'm going to focus first on lead paint. This is something that I'm sure many of you are already familiar with. It tends to be one of the toxic chemicals that gets coverage in existing curricula for health professionals. As we know, heavy metals, including lead, but also arsenic, cadmium, mercury, have been studied extensively and been linked to neurological damage, cancer, kidney damage, and poor brain health. We're exposed to these chemicals via different pathways. For example, the numbers are changing a bit here, but it had been assumed that around 70% of exposure leading to elevated blood levels in children came from lead paint. We're clearly learning more about our exposure to lead in our water systems now, and we can talk a bit more about that as we move through things. In the next slide, I believe, talks a little bit that. So the Flint water crisis really put a fine point on needing to look at our communities and where lead might be found in our water systems. One of the things that's listed here is also schools. What's been happening in the state of Michigan is many different school districts have been testing their water for lead. And one of the policy proposals that we'll talk about at the end of this presentation is to make sure that we are filtering our school and daycare drinking water to ensure that children are prevented from coming into exposure with lead. And the problem with lead in school drinking water in particular is the fact that our schools are not moving water through our systems just like we might in a home as frequently as we are. So over long breaks, over weekends, over the evenings, water is staying in the school plumbing, and unfortunately the corrosion control chemicals that are added to our drinking water systems are not effective after long latency periods in pipes. So even if a school district doesn't have lead service lines or something along those lines, which we heard quite a bit about, rightfully so, for Flint, and we're hearing about more in other communities as we are implementing our new lead and copper rule in Michigan and finding more communities that are in areas of exceedance. So they're popping higher than they should for, well, no lead is safe. They're popping high with lead in particular communities. The same thing can happen in schools, even if you don't have a lead service line. And the reason, again, is that latency in the plumbing, that if it has any lead, which unfortunately until 2014, lead was allowed in brass fixtures at a fairly high level. That has been reduced, but the same could be said of other lead plumbing, which it is still legal and it is still considered to be lead-free if current metal plumbing has a level of lead that is 0.25% lead. Mara can correct me if I messed up that number. So unfortunately, lead is still legal and allowed in our plumbing systems, and again, we're having that exposure there. Arsenic is a concern for many different Michigan communities that are relying on well water. It's naturally occurring. So it's something that folks should be testing for and filtering out if they do find it in their water. Um, you probably have heard about the PFAS in drinking water contamination. I mentioned it earlier. These are just a few communities that have popped high for PFAS chemicals, including our drinking water system here in Ann Arbor, the city, the area of Oscoda around Wurtsmith Air Force Base, which was contaminated by firefighting foam that contains PFAS from the Air Force Base training exercises there, Rockford or Belmont, Michigan, where the Wolverine Worldwide contamination is, and actually Plainfield Township, an entire area over there, is contaminated over in Kent County, Parchment, Michigan, just outside of Kalamazoo, Michigan, from contamination from paper processing paper that was using PFAS. And then again, with our Ann Arbor contamination, these are just to name a few, that comes from contamination largely attributed to tri-bar manufacturing, which does chrome plating on plastics and used PFAS chemicals as a suppressant for hexavalent chromium to make chrome. PFAS is used as a spray in that way. And they were using the longer chain PFAS chemicals until 2015. They stopped using those. It's not clear to me yet if they're using some of the shorter chain chemicals. We will have an entire webinar on PFAS and another one on lead. So really going to dig into those issues here. But finally, just to round out what we're talking about with drinking water, we also have another chemical, 1,4-dioxane, that's a problem in Ann Arbor's drinking water. There's a number of folks whose wells, who are not necessarily on the city water, right now have been contaminated from the old Gelman, now the Paul manufacturing area where 1,4-dioxane was not properly disposed of. And there's a plume that we are concerned will actually reach the Huron River, which is the main source of water for the city of Ann Arbor. So I mentioned PFAS. Here's a little bit of information on those. This is relevant, and as I said, we're going to have a whole webinar here. But I want to just tell you a little bit about the long chain versus the short chain, because you'll hear more and more about this, that we've moved away from the most harmful PFAS chemicals is what you'll hear from industry or certain folks. And we've moved away from some of those long chain chemicals like POFA or POFS, but we are substituting in many of the short chain. So with 6 carbons, C6 or Gen X, or some of the, and I don't have it listed here, some of the fluoropolymers, which still have detrimental effects across their life cycle. For example, you still are producing these chemicals in particular communities, be they here in Michigan or in other states. You have disposal issues where you cannot actually destroy these chemicals in a really good way, even with high temperature incineration. Precursors to the chemicals are released, and so you have the problem of them, in addition to many other different problems with incineration, you have a problem of them coming back together in the environment and contaminating again. We know of, over 5,000 different PFAS chemicals, and about 3,000 of those are commonly used in commercial use right now. Again, these are the chemicals that are found in manufacturing production for many of the things we use every day. As I mentioned before, I talked about phthalates being the everywhere chemical. We call PFAS the forever chemical. Again, they don't break down in the environment. There's no way to really just break those really strong carbon-fluorine bonds, and they have negative health impacts as well. So here's a list of many of the different things that PFAS chemicals can be found in. I mentioned some of those already. You can see firefighting foams is on the list. That's something that's particularly of concern in many Michigan communities. Oscoda is an example there. When you think about mist suppressants for metal plating, that's our contamination from tri-bar manufacturing in the Huron River. That's one of the sources, and then our Ann Arbor drinking water. There are many different health risks associated with PFAS. Some of the ones that have the strongest links are related to elevated cholesterol, suppressed immune response. So the effectiveness of vaccines, for example, can be impacted by exposure to PFAS. Something that we should be very concerned about is obviously we have other viral diseases that we're concerned about as we're creating new vaccines for hopefully for coronavirus and others in the future. We want to make sure that those vaccines are most effective and not impacting people by suppressing their immune response, suppressing the effectivity there. I want to jump down to reproductive health problems and also some of the issues there. So actually, I think it would maybe be it is a reproductive health problem, but it's an impact in children actually when they're born. There's an interesting study that we can share with you all out of Italy that has really looked at genital formation in boys that are exposed to PFAS chemicals, finding that they tend to have a shorter penis to anal distance, which can be problematic. And also smaller penises and lower sperm counts. So there's certainly reproductive health impacts that are emerging and that we're showing more and more information is coming out about the impacts of these chemicals. If we jump up to the kidney disease and testicular cancer, for those of us who work with firefighters and know the importance there and also know about the extreme exposure those folks have from PFAS containing firefighting foam, as well as other chemicals, we know that firefighters in particular have much higher rates of kidney disease and testicular cancer than the general population. So we'll talk a little bit more about firefighter foam chemicals in the future, but this is one of the areas where we are concerned, and we want to work with our fire services in the state of Michigan and the other states to ban the use of PFAS chemicals, moving to safer fluorine-free firefighting foams that are still effective, that still meet efficacy standards, but don't have the same negative health impacts for our communities and our firefighters. So you can see a little bit here about PFAS entering in the water cycle. I'm not going to spend a ton of time on this. It shows that we have exposures coming to our communities from firefighting training runoff, sewage sludge that can be applied to agricultural fields, unfortunately, chemical manufacturers and industries emitting directly both into the air or the water, or even wastewater discharge from both community wastewater discharge and industrial wastewater discharge there. Okay. Moving away from PFAS, the other chemical that I want to spend a little bit more time on talking about in our home environment are flame retardants. So the image here shows that we may have halogenated, particularly brominated and chlorinated flame retardants, or other types of chemical flame retardants that are commonly added to the furniture and electronics in our home. And unfortunately, these chemicals have been associated with nervous system, reproductive, developmental, immune, and endocrine disruption. One class of chemicals in particular that we have taken action on in Michigan, so we do know that it can make a big difference when we have state level policy, are two polybrominated diphenyl ethers, or PBDEs, that were commonly found in electronics and furniture. And those were octa and penta, PBDE. There are still imported products that are coming into the United States that do contain PBDEs, manufacturers producing products here, or the main companies that you might buy your TVs from and such that are not sort of off-brand have moved away from some of those halogenated flame retardants, but there are other chemicals of concern there. Another one that unfortunately we have is a case of kind of a toxic whack-a-mole, if you will, with flame retardants in consumer products. We moved from PBDEs back to chemicals like chlorinated tris, which is a neurotoxic chemical that had been banned from the use in children's pajamas all the way back in 1977 when it was found to be mutagenic. This is listed in California on their Prop 65 list as a suspected carcinogen. So we were able to get out of PBDEs, and then we were moved into, unfortunately, industry moved to chlorinated tris compounds. Those metabolites, I mentioned its neurotoxicity can be as neurotoxic as the pesticide pyrophos, which is a compound whose use was curbed specifically because of its neurodevelopmental toxicity in children. So we are moving from one toxic flame retardant to another, and unfortunately the story doesn't stop with chlorinated tris. We're seeing other novel flame retardants that do have health impacts on people. We will continue to work on those. I'm going to talk about some of our campaigns around children's car seats later in the presentation. I mentioned firefighters before with PFAS, and this is just another example here because unfortunately when products that contain hazardous chemicals like flame retardants do combust, they produce particularly toxic byproducts. And you can see some of the higher cancer rates in particular with firefighters from the National Institute of Occupational and Safety and Health study here. Which is a good segue into thinking about occupation and maybe where you work and the exposures you might have. So there's many different occupational diseases, but I'm going to focus on emerging science related to exposure at work and increased rates of breast cancer. So for example, here in the state of Michigan, it's particularly important for us to think about plastics manufacturing and breast cancer, specifically related to auto parts. So there's a study by Brophy and Keith, it's a few years ago now, that have found across all sectors, premenopausal women in jobs with high exposure to carcinogens and endocrine disruptors had an elevated breast cancer risk in particular. But specific sectors with the greatest risk were automotive parts, plastics manufacturing. And we've had conversations with our friends at the UAW about this and are continuing to push for as many safety protocols that we can to make sure that automotive plastics and foams don't contain toxic chemicals like isocyanates. When you think of ABS plastic, you've got a number of different chemicals that are toxic just in the manufacture of that. So how can we push the sector to move into safer products, first of all, and then practices when need be to protect people? So canning is another industry that's been particularly has a particularly high premenopausal breast cancer risk for women. And this is related mostly to being exposed to endocrine disruptors like BPA or bisphenol A, bisphenol S in the canning process. So I want to take it a little bit closer to home for many of you. To the hospital sector and look at exposures that healthcare workers might have to toxic chemicals. Now, this is an older report now, but Physicians for Social Responsibility put out a report on 20 different nurses and physicians. And the reason I mention it was that we did participate in this. We had several health professionals from Michigan. They tested positive for over 24 harmful chemicals like those flame retardants, polybrominated diphenyl ethers, or PBDEs, phthalates, mercury, you can see the whole list there. Those chemicals, again, have links to different health impacts listed on the slide that we want to be concerned about. There are many different efforts, and we'll talk about some that are happening with our friends at Healthcare Without Harm and Practice Green Health to green the healthcare system to reduce healthcare workers' exposure to these toxic chemicals on the work site. So One of the things that we will not focus on very much in this particular fellowship program are the personal choices that people make in terms of diet, alcohol, cigarettes, pharmaceuticals, illicit drugs, and so on and so forth that can have negative health impacts. This is incredibly important, but when we're looking at environmental health issues, we are narrowing them to the exposures that you might have from your community, in your occupation, in your home, and things along those lines. So these are incredibly important. The medical system is quite focused here, as they should be, on the impacts that these different areas, these personal choices may have on health. But we want to make sure that we are getting folks to focus on some of the areas that sometimes get less attention. One area that we mentioned earlier in the slides when we talked about the individual susceptibility or synergistic effects are the socioeconomic economic factors that come into play that increase the risk or increase the exposure to environmental toxicants for a variety of reasons. Unfortunately, populations of lower socioeconomic status may lack the political clout to reduce pollutants. They may not be able to stop polluting industries or shut down polluting industries in their neighborhoods. That is not always the case. We have an incredible victory just in the last year of shutting down the Detroit incinerator, the solid waste, municipal waste incinerator there in Detroit, in an heavily impacted community, being able to protect residents there. So when folks do come together and organize in areas that may even have that maybe socioeconomically, it may have certain socioeconomic challenges, they can make tremendous amounts of change. It did take a very long time to shut that down. There were quite a few hazards problems, excuse me, and quite a few, decades of work by Ecology Center, by our partners in the Breathe Free Detroit Coalition, and others to shut down that polluting incinerator. But it can happen over time. One of the things that we also see again with socioeconomic factors that should be thought about in terms of exposure to toxic chemicals is thinking about what is the condition of the housing that someone might be living in. So this is a factor that's really important in terms of lead and lead paint. And we know that if you're living in a rented home, you're just statistically more likely to have higher levels of elevated blood lead levels in children than if you're in an owner-occupied home. That can happen because there are some landlords that aren't taking care of their properties in a way that prevents lead paint from chipping off of windows or doors or the walls. You may have water that is causing lead paint again to peel off if you have a leak in a roof or in a home. That damage can happen to the water damage can cause additional lead paint contamination in a home, and so on and so forth. So these are just some of the examples here. And again, I'm focusing on toxics, but you'll hear from Alexis and others on particularly on the climate issues related to socioeconomic issues and poverty, and then also food access issues from Catherine, and making sure we have a sustainable food system. So this can be all very overwhelming. What we want to do in this fellowship program is bring you back up. The first part of my presentation is it can be, I know, a bit overwhelming to hear about all of these different challenges, but there are many different things that you can do. And this is what we want to focus on for the fellowship program, is really help you develop the toolkit in any one of these areas that I'm going to talk about, or multiple areas, to make a difference. So the first thing is really working in healthcare systems. If you work in a hospital, in a healthcare system, there are many different things you can do with our partners at Healthcare Without Harm, who we can connect you with Practice Green Health if your healthcare system is already a partner with them, to green what you're working on. So for example, I mentioned healthcare I guess healthcare is an incredibly large part of the economic sector in the United States. And so changes that can be made there can actually have market changes in other areas. For example, I'll talk in a moment about city level procurement policies and moving to making sure that communities are buying environmentally preferable purchasing. Healthcare really was the industry that led the way in making sure our industrial furniture manufacturers, many of them based right here in Michigan, moved out of flame retardants, moved out of PFAS and phthalates and other toxic chemicals to make sure there were items on the market that would not negatively impact people's health, that hospitals and healthcare systems were interested in purchasing, and that really created demand for those products to be available elsewhere. Another example recently with PFAS is that many different folks in the healthcare industry led the way on pushing for carpeting to not contain PFAS chemicals for again, institutional carpeting. And this has really led to both a market movement and opened the door for residential carpeting to move away. And we've got some market victories that I'll talk about here in a moment from PFAS in consumers carpeting. And really, we expect that there will not be PFAS treated carpeting easily found for sale in the United States in the next few years. So we're seeing an entire sector move away from toxic chemicals because of the efforts that started in healthcare and then have trickled down, so to speak, and moved into other areas. So this is the Healthier Hospitals Initiative. And it's a practice green health program. Again, this is a program that if you are in a healthcare system, you can sign up for this challenge. If you're a partner with Practice Green Health, there's information on what you can do in terms of healthy interiors, mercury elimination. We talked about PVC and DEHP, so those chemicals that are found in a lot of plastic IV bags and tubing and things along those lines, and what you can do even with green cleaning in the hospital to ensure that both workers and patients are not exposed to these toxic chemicals. So in addition to that, we at the Ecology Center and many others have quite a few campaigns focused on moving the marketplace to safer products. And I mentioned carpeting, and so if you can see here at the bottom, you'll see the Home Depot. And one of the things that we've done with carpeting is through our testing and our Healthy Stuff project, we tested carpeting and rugs that we purchased from retailers like Home Depot and Lowe's. We showed that they contain PFAS chemicals, and we were able to get those major retailers to commit to not selling any carpeting or rugs with PFAS chemicals this year. So this campaign happened last year, and they have pulled those products from the shelves. They're not stocking them anymore. And this has happened before. Before carpeting, we were focused on vinyl flooring and vinyl floor tiles from these retailers and others. And we were able in 2016 to get them to stop selling contained the toxic endocrine disruptor that I've mentioned before, phthalates. We've done follow-up testing on vinyl that we've pulled from these retailers that we've purchased, and it does not contain these chemicals. We work in national campaigns on many of these projects. So you'll see in the top there, the Mind the Store campaign. They're partners that work across the country with us and push the nation's retailers to take a lead on things. We've been able to push different food companies and grocery stores like Whole Foods or Sweet Green to stop using PFAS-containing disposable food products, so packaging or molded fiber compostables that have been contaminated or that have been treated with PFAS, getting them to pull those off of store shelves. So these are often campaigns that are driven by consumers. Health professionals can have a role in those in talking about the health impacts of the chemicals, and then also talking about what alternatives there are and what folks could do. I talked about flame retardants, so I wanted to spend just a moment on a campaign that continues at the Ecology Center and that we've been working on, gosh, for over a decade now, and that's to get toxic chemicals out of children's car seats. These are a very necessary, as we know, health and safety device for children whenever they're in a car. We have done, oh gosh, I think it's 12 years of car seat studies now, and found incredible improvement over the years, moving away from heavy metals in car seats like lead, moving to flame retardant free car seats. In 2017, for example, the company Up a Baby introduced the first flame retardant free car seat. And by 2019, there were 16 flame retardant free car seats. So just in a few years, we've pushed this sector of the market to stop using these chemicals. We've started testing for PFAS chemicals as well in our lab and working with academic institutions, and we were able to get a number of companies to move out of using those. So now you can find a car seat on the market at any stage of life that your child is in, everything from infant car seats to convertible car seats to those to booster seats that will not contain toxic flame retardants. Many of these are still a bit expensive, and so we're working to keep pushing the industry to make sure we have more affordable car seat options, so that it's not an economic matter, that everyone can afford a car seat, no matter how that is safe and doesn't contain toxic chemicals, no matter how much money they have. So here's a little bit of our 2018 testing, and the fact that we first started testing these chemicals for PFAS. And that's Alexis's little boy there. So one of the things that a number of you have expressed interest in, and is definitely a big part of this, is actually changing the law. So what you see here is a rally that was held, Stroller Brigade, to change the Toxic Substances Control Act, which is the law that essentially regulates chemicals in most of the stuff that we use every day. This is under the EPA, and this law, it covers chemicals that are in our everyday products, like our computers and our cars and things like that. It covered almost everything except, it's easier to say what it doesn't cover, except personal care products or cosmetics, pesticides, food and drugs. Those are under the FDA, a number of these. Pesticides is another EPA program. Food, drugs, and I think that's it. So we will continue to push for strengthening our federal chemicals policy, both the main law and then a number of different things. For example, with PFAS, our focus in the last couple of years has been on how do we get the FAA, the Federal Aviation Administration, and the Department of Defense to change the standards that they use for firefighting foam and PFAS, to move out of those to safer fluorine-free examples. So that's something you're going to continue to hear about. The National Defense Authorization Act is a bill that comes up every year before Congress, and so we were able to get some good provisions in that in the last cycle for PFAS and removing PFAS. And our Michigan congressional delegation has been incredibly helpful in thinking about it, really in a bipartisan way, particularly with Fred Upton on the west side of the state, a Republican who's been a leader on this. And then most of the Democrats have been out in front on PFAS. So, but not all action has to happen at the federal level. One of the things that our fellows have helped us with in the past is ensuring that we have good policies available, and are talking with local lawmakers in particular about what you can do in a city to purchase products that don't contain harmful chemicals. So in 2018, after a couple of campaigns that we worked with our fellows and their practicum projects, the city of Ann Arbor created a model chemical purchasing policy for consumer products that they're going to purchase from the city to make sure that they didn't contain toxic chemicals. They updated this policy just last year, and now includes a prohibition for the city itself to purchase single-use plastics and things like that. So it's being shared. We have a a roadmap on our Ecology Center website, and we are working with cities across the country and across the state to implement their own non-toxic, environmentally preferable purchasing policies. There's a webinar that's likely to happen in early April that we can share with you all. The target audience is going to be folks who either work in sustainability or folks who work in purchasing for cities, but you may find it interesting. And I'm happy to talk to folks more about this, and you'll learn more as we go through the program. At the state level, I'm almost done here, want to wrap up about talking about a couple of different main policy areas on toxics that are that will be important this year and have been for quite a few years. Again, we want to focus on lead, and we want to focus on all different exposures, be they in homes from paint or soil or water, or wherever the exposure might happen, even in schools or daycares. Some of our primary prevention policy requests are to test every home at the sale or transfer of home, to make sure that we are testing homes rather than just using children as lead detectors in homes to find out if there's lead in various environmental media there. In addition to doing a LIRA or a lead inspection risk assessment, also to make sure that there's abatement in homes there. We want to ensure that there's universal testing of children at 1 and 2 years of age. This is a secondary prevention measure to make sure children aren't falling through the cracks. When we have tested more children, we have seen not only the sheer numbers of children with elevated blood levels go up in the state of Michigan, but also the percentages, suggesting that we are missing kids that have elevated blood lead levels and that we need to increase our testing. We want to make sure that we have enough funding for the state to be able to identify and remediate lead hazards. Fortunately, that has increased over the last few years, but we need to, particularly now, make sure that lead isn't forgotten, that it's not, again, a problem that has been solved, which unfortunately before the Flint water crisis, that was a bit of the feeling in the legislature. So we want to make sure that people are still thinking about lead, that we know it's still a problem, that we still do have high rates for elevated blood lead levels in children in Michigan. And then finally, making sure that we are putting in filter first policies for lead in school drinking water and in daycares across the state. And when we do our webinar on lead, you're going to hear a lot more about this. I talked a little bit about lead in school water and how it can stick around, and because the water sticks around in the pipes, you can have more leaching of lead than you might have in a home. So these are some pictures of lead education days and some of our fellows doing some lobbying in the past, and some of the reports that we have done on the economic costs of lead exposure down there at the bottom. I talked quite a bit about PFAS earlier, and again, we'll have a specific webinar focusing on PFAS, some of our policy proposals. The first one here in setting a health protective maximum contaminant level or drinking water standard for PFAS is underway. I'm going to talk more about that in a moment. We want to make sure that we are following other states that have banned the use of firefighting foams. We do have a take-back program that has been established right now. It's voluntary for fire departments across the state to give their PFAS-containing firefighting foam back to the state for hazardous waste disposal through solidification, encapsulation, and landfilling right now. Again, as I mentioned, there's not a great way to destroy these chemicals. From our perspective, the encapsulation is better than incineration at this point, and we will know where the PFAS is kept, and hopefully in the future we can actually destroy it later when new technologies evolved. I talked about purchasing at the city level. This is something that we want to work on with our state to make sure they are doing environmentally preferable purchasing and not purchasing products that contain PFAS. Making sure that we continue to have good funding for testing for PFAS chemicals in our community water systems, in our surface water, and other environmental media like biosolids that are essentially from or sewage sludge that comes out of water treatment plants and so on. We need to make sure that we have treatment funding that's provided to water utilities and to private drinking water well users to make sure that we are protecting people again when we have our drinking water standards improved. And then make sure we have a publicly available database. So that first thing, let's see, oops, nope, don't know how to use my slides. The first thing that I mentioned of the setting a PFAS maximum contaminant level for drinking water standard is well underway. So this is a bit of an update from our presentation with folks even last year. The first phase of the process started by Governor Whitmer was happened in July of last year. So draft standards were released for 7 different PFAS. You can see them there. Unfortunately, from our perspective, from other health professionals' perspective, from advocates working with in breastfeeding or in learning disabilities or in other areas, these standards are not quite strong enough to protect public health. We brought this up in a stakeholder process that Ecology Center, other environmental organizations, drinking water utilities, industry, and others participated in the fall. And again, in January in a public comment period. Unfortunately, there were no changes. Well, I guess fortunately and unfortunately, there were no changes to the draft standards through either of these processes. On the other hand, because you had people coming from both sides of things, and industry was suggesting the standards were much too high and that they should be, much too low, and that they should actually be less health protective. The fortunate side is that they are moving through. Just a few weeks ago, they passed through the Environmental Rules Review Committee, which we affectionately, so to speak, call the polluter panel here in the state of Michigan, and will be moving on to their final phase to pass through the Joint Committee of Administrative Rules in the legislature. They were supposed to be finalized by April. I don't know if or how that will be delayed in terms of the new things that with the virus that the legislature is dealing with in the administration. So I would anticipate that we might see a delay in that rulemaking process. And that is it. So I wanted to just take a moment and find out if folks have any questions or if people would like to discuss anything. I cover quite a bit of information there. So thank you for your attention, and we'll go from there. And I will try to figure out how to turn my camera back on.
Great. Thanks, Becca. I know one of the first questions we had in the queue was from Steve. Steve, if you want to unmute yourself, you're able to ask the first question.
Okay, hang on, I'm resetting up so that I can do this. Can you guys see me?
I just lost you. No, I can't anymore, but I did see you before.
It doesn't matter.
Okay.
In any case,
oh, there you are.
I think I'll be more effective as an advocate if I actually read the background literature underlying that slide that showed the health effects of PFAS
yeah.
on all those systems, just because it's better for me to know so if someone challenges it, I know more what I'm talking about. So are you going to make available a bibliography or send us to sources or whatever?
So one of our former fellows, Stephen, I think you know her, Dr. Elaine Schotnier, has done a literature review on the impacts of PFAS chemicals on health. And so we will share that with everyone. And then you can also dig into the literature itself. But she's done a really excellent job of looking at, I think she's updated it in the last year or so, on the literature that has emerged on these chemicals and the impacts on health. So we can put that, we're going to have, Mara will talk about some of the logistics later, but we will have a website for you all that you can log in and you can pull down these slides and the recordings and things along those lines. So you'll have that material we can available for you just to find it at a click of the link.
Great, thank you very much.
All right, so we can open it up now if anyone else has any questions or have anything they want to discuss further, we have a couple minutes.
I just have a comment. When I worked in the prison system in 2010, I think it was, I worked with a psychiatrist who was really interested in how the chemicals in the poorer communities impacted the developing brain, and she strongly believed that that's why we see a lot of criminality as well that comes out of those populations. So I thought it was really interesting, you know, hearing all the points about the in utero transmission of toxins, because it makes perfect sense to me for sure. And looking at those poorer communities and cleaning them up, we might see a dramatic shift and, you know, behaviors.
You definitely see some really strong links in the literature related to lead poisoning and, you know, behavior issues, higher association with people who are have elevated blood lead levels and then go on and are in, you know, because of impulse control issues or things along those lines, and end up in juvenile delinquency centers or associated with adult crime. And we've done cost analyses at the Ecology Center on that. And when we do the specific presentation on lead, we'll dig in a little bit deeper on those issues and what those rates are and what we could see with what are the cost exposures. And obviously everything that's a cost exposure is linked to somebody's life.
Right.
And so making sure that, you know, we're not just talking about it in abstract terms there, but sometimes when you talk to a lawmaker, you have to use the dollars and cents to reach certain people. They won't necessarily, you know, understand the moral argument on why we need to address these chemicals or the health argument right away. Sometimes you have to show them the bottom line. So we'd like to be able to prepare you and give you all of the tools that you need to make that happen. So those resources, again, we're going to give you this. There's a lot of information over the course of the fellowship program that you can read up on that study and others as well.
And I also like that you pointed out that you know, that there's more than one element at play sometimes, like malnutrition for either the pregnant mother or the young child also might impact that a lot more, which I think is super interesting as well. So thank you for that. And I look forward to more information.
Thanks.
I just wanted to say that I appreciated your comment. I think that a lot of people still are not aware that lead poisoning is still a really relevant issue in a lot of marginalized communities. A lot of people think that, you know, having lead in their paint is an issue that, you know, kind of died away in the 80s and 90s. But we have a lead testing program here for clients at Access, and we have an employee here who goes out into people's homes and tests their paint for lead. And we still see that there's a lot of elevated lead levels in the paint in a lot of the homes that we go to. So I think it's really important that you made that comment. So thank you for that.
Thanks. Definitely. And, you know, I know Waleed is working for Center for Urban Studies, and they're doing incredible work as well in Detroit on lead issues, and a good partner of Ecology Center in Detroit and in other places in Wayne County. And I know Access is doing incredible work too. So we're always very excited when we meet the new cohort of health professionals, and knowing that you all are connected with other organizations that we're partnering with already, and then making new connections as well. So. Other questions? Are there other things that we didn't cover that you want us to try to cover later in the program on toxics?
Actually, I wanted to just make a note that I actually do some of my research around breastfeeding. So I was really excited to hear you talking about breastfeeding. And I'd be excited to hear more about that as we go forward on toxics.
Great. Catherine has quite a bit of expertise in this area, and she's going to talk about sustainable food systems. Catherine, I don't know if breastfeeding is going to be a part of this, but she can talk about those connections as well, and the importance of supporting that And then how do you carefully talk about issues like toxic chemicals and protecting women and protecting health in order to protect breast milk and to protect children?
Excellent.
Yeah, I won't be talking specifically about breast milk today, but it's something that, as Becca mentioned, I have worked on, and I'd be glad to follow up with you, Heather. We can have more conversation about that.
Yeah, and I'm looking forward to hearing more about the toxins in our goods that we buy in our home that a lot of people, I think, don't really recognize or put a lower level of importance on it than maybe they should, especially those people with young children. You know, I see a lot of people in the community doing home renovations. My mother herself lived in 2 new constructions and she had a lymphoma. You know, I wonder what the off-gassing of the glues that we're using, because I know that some of that has links and all of that. But even just, you know, the basics of like in the furniture and in carpeting and stuff like that. And I love hearing that Michigan's making some strides getting it out of our markets. So thank you for that work too.
Yeah, I'm just I work from a very trauma-focused perspective with the children and families that I see. I have a lot of kids that come in with you know, symptoms that look like ADHD or get diagnoses of those things that often overlap with symptoms of post-traumatic stress disorder. And I kind of view those types of symptoms as ways that the mind-body system is responding to trauma and coping with trauma, and then thinking about the ways that these chemicals are also traumatic to our systems, and just thinking about the ways that, you know, our bodies are responding, you know, and how they present with these health conditions. And so it's just kind of giving me another layer to think about. And so I really appreciate, you know, all the info today.
Yeah, great.
All right. Well, I think we can wrap up there. Obviously, Becca will be on the line throughout other presentations. We'll also be sharing some follow-up materials about some of the topics that Becca covered. But for now, we are going to be taking a break. Our next presentation will start at 12 o'clock with Catherine. So for now, if you want, folks, you can just stay on the line. You don't have to do anything. Just be sure to be back here at noon.